record keeping. OSHA's bloodborne pathogen standard applies to all employers who have employees who have occupational exposure to blood or other potentially infectious material, regardless of how many are employed. Under OSHA's record-keeping regulation, certain covered employers are required to prepare and maintain records of serious occupational injuries and illnesses using the OSHA Form 300. However, there are two classes of employers that are partially exempt from this specific requirement. Employers with 10 or fewer employees at all times during the previous calendar year, and establishments in certain low-hazard industries. A new list of partially exempted industries dated January 1, 2015 includes the following industries: offices of physicians, offices of dentists, offices of other health practitioners, outpatient care centers, medical and diagnostic laboratories, death care services. To clarify, the OSHA requirement includes the OSHA 300 log and associated forms. This requirement includes all employers unless exempt based on size or those in OSHA-determined low-hazard industries. It also includes any illness or injury, not just those that are bloodborne pathogen-related. The bloodborne pathogen standard requirement includes the completion of a Sharps injury log. Clearly, this is only for Sharps injuries, and as answered further in this section, if an employer is exempt from completing the OSHA 300 series, they're also exempt from maintaining a Sharps injury log. However, maintaining data on a Sharps injury log will make it easier to track injuries and ultimately make changes where injuries might be repeatedly occurring. Record-keeping requirements. From a bloodborne pathogens perspective, what needs to be recorded? All work-related needle stick injuries and cuts from sharp objects that are contaminated with another person's blood or potentially infectious material must be recorded. You must enter the case on the OSHA 300 log as an injury. A few reminders. The requirement to record an injury is in place only if the injury is work-related and was from a contaminated item. Also, when this training refers to the OSHA 300 log, it implies all of the required forms that accompany the OSHA 300 log. The following are non-bloodborne pathogen injuries that would also be recordable on the OSHA 300 log. When the injury results in days away from work, restricted work or transfer to another job, medical treatment that is beyond first aid. Please note, first aid includes non-prescription drugs, tetanus immunization, Band-Aids or steri-strips, hot or cold therapy, elastic wraps or other non-rigid supports, eye patches, and removing splinters. Detailed information regarding OSHA's definition of first aid can be found on their website. Loss of consciousness. Possibly a significant illness or injury that doesn't meet any of the above criteria. And death. If an injury to an employee has been logged and the employee is later diagnosed with a bloodborne pathogen, this information must be updated on the OSHA Form 300. Also, if an employee was exposed without a percutaneous injury, such as a splash, this must be recorded if it results in a diagnosis of a bloodborne pathogen, such as HBV, HCV, or HIV. The following is a brief overview of the required OSHA logs. As a reminder, this requirement is only for organizations that are not exempt, based on one of the prior listed exemptions. OSHA Form 300 is a log of work-related injuries and illnesses. In general, you must record every work-related injury or illness that involves loss of consciousness, restricted work activity, job transfer, days away from work, or medical treatment beyond first aid. This form must be used in a manner that protects confidentiality. OSHA Form 300A, or the Summary of Work-Related Injuries and Illnesses. This must be completed even if no work-related injuries or illnesses occur during the year. OSHA Form 301, or the Injury and Illness Incident Report. This form, or an equivalent, must be completed within 7 days of a recordable work-related illness or injury. Any alternate form must contain all of the information contained within the 301. Another recording requirement of non-exempt industries is the Sharps Injury Log. The Bloodborne Pathogen Standard requires all percutaneous injuries from contaminated sharps be recorded in a Sharps Injury Log. All entries must include the date of injury, the type and brand of the device involved, the department or work area where the incident occurred, and the explanation of how the incident occurred. This log should be analyzed annually to determine if there are areas where a risk reduction evaluation might lower exposures. As always, personal identifiers must be removed if a copy is made available to others. The following documentation is copied directly from an OSHA record-keeping requirement question and answer document. It's included in this training verbatim to clarify some common questions regarding record-keeping. Can you clarify the relationship between the OSHA record-keeping requirements and the requirements in the Bloodborne Pathogen Standard to maintain a Sharps Injury Log? The OSHA Bloodborne Pathogen Standard states, the requirement to establish and maintain a Sharps Injury Log shall apply to any employer who is required to maintain a log of occupational injuries and illnesses under 29 CFR 1904. Therefore, if an employer is exempted from the OSHA record-keeping rule, the employer does not have to maintain a Sharps log. For example, dentists' offices and doctors' offices are not required to keep a Sharps log after January 1st, 2002. Can I use the OSHA 300 log to meet the Bloodborne Pathogen Standards requirement for a Sharps Injury Log? Yes, you may use the 300 log to meet the requirements of the Sharps Injury Log, provided you enter the type and brand of the device causing the Sharps injury on the log, and you maintain your records in a way that segregates Sharps injuries from other types of work-related injuries and illnesses, or allows Sharps injuries to be easily separated. Medical records. All healthcare information regarding the name of the employee and the source individual must remain confidential. This includes vaccination records, blood test results, healthcare professionals' opinion, and any associated treatments. These records must be kept for the length of employment plus 30 years. The employer is responsible for the establishment and maintenance of medical records. They may be kept off-site. Training records. The training record should contain the date of training, a summary of the contents, the name and job title of those taking the training, and the qualifications of the person conducting the training. Training records should be kept for 3 years from the training date.